The next question, the member for Don Valley East.
Mr. Speaker, my question is for the Premier. It seems that every time the Premier makes a major public policy decision, wealthy, well-connected insiders always seem to come out on top. We saw it with the Greenbelt, where a small group of insiders became billionaires overnight. Are we really supposed to believe that this decision was about 1.5 million homes and not about $8.3 billion? Accordingly, when it comes to the Premier's expansion of private for-profit healthcare, can we blame Ontarians for wondering where his priorities truly lie? Mr. Speaker, this week, a walk-in clinic in Ottawa is operating that will charge patients desperate for primary care $400 a year, just to have the privilege of paying for visits. And we know that's not the only one of these kinds of clinics popping up in Ontario. To the Premier, while cash for access arrangements may be commonplace within this government, is it fair that he expects the people of Ontario to count this as the norm within their own healthcare system?
Okay. Government House Leader.
Coming from the member opposite, who just recently endorsed the only person in the province who still supports building on the Greenbelt. What a question from that gentleman. You know what, Mr. Speaker? We have said that we are not going to do that. We are going to continue to make investments in building homes across the province of Ontario. And because of that, we have to make more investments in building hospitals all over. You know why we're doing that? I'll tell you why we're building hospitals and reinvesting in hospitals and long-term care, because for 15 years, the government that you are now a party member of literally never did it. They built 611 long-term care homes across the province. So I would ask the member this. If he could call his partner and say, listen, people have spoken, we need help building homes, but building on the Greenbelt isn't the way to do it. I wonder if he might do that to the person he just endorsed in the Liberal leadership, because I saw the other candidates and they are simply against that as well.
The supplementary question.
That's not necessary, Mr. Speaker, because it's not going to happen. But I'd like to remind the Premier of a saying he has burned into the minds of Ontarians this year. He said, all you need is your OHIP card, never your credit card. Kind of reminds me of that famous video where he promised not to touch the Greenbelt, and then he did. History is repeating itself. Walk-in clinics like the one in Ottawa are just the beginning. Bill 60, which was executed swiftly just like the Greenbelt, was said to be about clearing the surgical backlog, but it's just another cash cow. It opens the floodgates for private clinics to profiteer on publicly funded surgeries, meaning the people of Ontario will be bankrolling clinics that have a financial incentive to provide the lowest quality care possible. Mr. Speaker, the Premier said that real leadership is about being able to admit when you've made a mistake. Will he reverse his decision on private for-profit health care the same way he reversed his decision on the Greenbelt?
The Deputy Premier and Minister of Health.
Speaker, I want to be very clear, and I want the member opposite and everyone to understand that we have always and we will never tolerate clinics, organizations to charge OHIP-funded services. We will make sure that is the case. Having said that, in terms of expanding the access to primary care and to surgical diagnostic centres, 100%. We need to do it. We have done it. You know, I talk about a change that the Premier made in January where we expanded cataract surgeries. We have now, as of that one change, had 19,000 minor eye surgeries in the province of Ontario because we made an extension in January. We have a plan, Speaker. That plan is working. I understand that the member opposite is suggesting that he would like to shut down some of these organizations that have been doing minor surgeries in communities for decades in the province of Ontario.
Thank you. Thank you very much.